I hope you're having a great Friday. Today, I wanted to discuss drainless tummy tuck versus a tummy tuck where you have a drain placed. So I've had patients ask me which one is superior, which one gives you better results, which is better. And so first off, let me just start off by saying my tummy tucks, I do not use a drain. And whether you use a drain or you don't use a drain, it's all surgeon preference, and you can get fantastic results either way. So one is not superior to the other. It's all surgeon preference. So I always think to myself, if I were having this surgery or a family member, what would be the most comfortable and safe and, and still give you a great result. And so if I were having the surgery, I wouldn't want to have to deal with the drain. And especially to patients who aren't in the medical field or family members taking care of them who aren't in the medical field, a drain can be really daunting and like scary for the family. And so you have to take care of the drain. You have to strip the drain to make sure it's flowing. You have to record the drain output. It can be tugging at the skin, usually stays in for 1 to 2 weeks. So it's kind of uncomfortable. And so, so I do not use a drain. What I do instead are progressive tension sutures and quilting sutures. So what is that? So progressive tension sutures help take tension off of the lower abdominal incision. So pretty much I do stitches that that help distribute the tension along the entire abdominal flap, so that you have less tension at your incision. And then also the quilting sutures help decrease the dead space, is what we call it, or decrease the space where a fluid collection can develop. So the quilting sutures I put throughout the abdomen, and that helps quilt the skin tissue abdominal flap down to the muscle fascia. And the fascia is the covering, the connective tissue covering of the muscle. So that helps decrease the space where fluid collection could develop. And a fluid collection is called a seroma, and it's your body's response to trauma. So your body sends cells, inflammatory mediators, and your body produces some fluid that is inflammatory in nature. And so a drain helps to drain that fluid. But if you do progressive tension sutures and the quilting sutures like I do, that decreases your risk for having a seroma. The thing is, even if you have a drain placed, when the drain comes out, you can still potentially develop a seroma. So, so I just think that a drainless tummy tuck is, in my hands, I get decent results, and it's safe and it's effective. And the only downside is it takes longer. So I think it's just more work for the surgeon. So that's part of the reason why not all surgeons do drainless tummy tucks. So it does take me about 35 extra minutes or so to do the extra stitches and do the extra measures, so that I decrease my patient's risk for developing a fluid collection. And so, so that's that. If you have any questions, just let me know.